Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. So today's session is that we're going to go over how to reduce knee pain. A little bit about me. My name, I'm a physical therapist, and I've been in the physical therapy field for over 20 years. And I received my doctorate from Mercy College in upstate New York. I also have BS in exercise science from Rutgers in New Jersey as well. And I specialize in orthopedics, musculoskeletal injuries, sports injuries, all that good stuff in this physical therapy clinic, and to help you move better, feel better, and play better. So if you have any questions during our session today, make sure that you use the chat box or just kind of use one of the raise your hand icons there, that button, and let me know so that we can cover all the things that you have questions with to make this session as worthwhile to you and as informational as possible. So let me bring up my slide here. So today we're going to talk about how to reduce knee pain. And if you've been to my talks before, my webinars, the one thing I have to tell everybody is that this is not physical therapy. The advice and the stuff, that information that we're going to go over today is based on a targeted towards a general population. These are issues that may affect a lot of people, but to get your specific issues taken care of and getting rid of your own personal individualized deficits, I suggest seeking help, a consultation from a medical professional so that you get your issues addressed. All right, so moving on, the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result. So we're talking about the knee today. The knee is classified as a stable segment, all right? It's a very simple joint. Really, all it does is just bend and straighten. It likes to bend and straighten, and bend and straighten along the axis of that joint. Oftentimes, if there is something where the knee becomes unstable or becomes too mobile, or it starts to bend off axis and it's not stable, then we run into issues. But we can't forget how the leg functions. The knee doesn't function just in isolation. It functions as a result of what's going on above and below it. So if we look at what's below it, we have the ankle. This is our next joint down, and that's going to be the mobile segment. And that has to be mobile. Oftentimes people come to me with knee pain, and if they have a tight ankle, limited ankle mobility, then that represents usually as knee pain. Your body tries to seek and make up for the range of motion that's lost at the ankle, puts more stress on the knee. If we look above the knee joint at the hip, that hip needs to be a mobile segment as well. So if the hip is tight, if it doesn't move through its normal physiological range of motion, if you're missing a piece, then again, that can put more stress on the knee. The other thing too is that we'll talk about is hip strength, because that plays a big role in how your body attenuates force and controls for knee position when you put your foot on the ground, whether it be walking, squatting, taking stairs, lifting up something off the ground. So we'll cover that as well today. So we're going to cover the importance of hip strength and flexibility, the importance of knee range of motion, and the importance of ankle mobility. And we do that through basically three things, right? Soft tissue, or actually four things. Soft tissue mobilization, joint mobilization, stretching, and strengthening. So you probably are familiar with the last two, stretching and strengthening. If we have a weak muscle, we need to strengthen it. If we have a tight muscle, we might need to stretch it. But there's also joint mobilization, where we take a joint and try and mobilize it, make sure that joint moves well through its required range of motion to express its full capability. And then we have soft tissue mobilization. What is that? Well, if you've ever used a foam roller or some type of trigger point release ball or something like that, that classifies as a soft tissue mobilization. We get the different layers of tissue above or below the targeted area, whether it be skin, the muscle, or the muscle surrounding that muscle. we want all those layers and interfaces to slide and move. It's all about sliding surfaces. If we lose that sliding surface component, oftentimes that will cause that muscle to not be as mobile. It'll feel tight. It's not going to be stretchy. It can't extend all the way. It can't stretch all the way. It can't lengthen, or it cannot shorten all the way, where you miss the ability for that muscle to contract and move the joint through that range of motion. All right, so let's pull up my two-shot here, my camera, take this down, and let's talk about some hip stuff. So soft tissue mobilization, right? We have a foam roll here. We're going to start with that. The foam roll is pretty useful in creating the shearing. So we're going to start at the hip, and the muscles that we're concerned about is the glute and also the hip flexor. Now the hip flexor starts on the lower back. So one of these muscles called the psoas muscle, it starts on your lower back, dives through the abdominal cavity and inserts into the front part of your thigh. And basically it just flexes the hip, right? So it flexes the hip and moves the hip up. And we want to be able to extend the hip, get the hip moving backwards. If we lose that hip extension, that can create extra tightness down the thigh into the quad and more compressive force on the knee. And also that can radiate into your lower back as well and make your back feel tight. So what we want to do is get onto our foam roll and go from, say, our pelvic bone down to just above the knee. All right. So make sure that I'm in my shot here. I'm just going to get down onto the foam and start just kind of rolling up and down. And because this piece of muscle is a three-dimensional piece of muscle, it wraps around the entire front and sides of my thigh, I want to capture all the different areas. So I can go up and down like so. Let's see if I'm getting from the top here. Let me just tilt this down even more so you can see all the different angles that we're talking about. All right, so if I'm here, I'm going to be rolling on one side, and I can kind of turn my knee out and roll on the inside of the thigh to get the inner quad, or go to the outside and get the outer quad. And that outer quad, that lateral quadricep muscle, goes all the way to the side, and it kind of runs underneath the iliotibial band. And you can kind of roll that all the way up to the front part of the pelvis. So hopefully you can see that, right? So I'm in the front part of my pelvis here. I can kind of shear that by moving my hips side to side. So I'm not just technically just going up and down, just rolling without purpose. I want to create really shearing tissue from the superficial surface to the deeper surface, rolling and creating shear. So as I find a spot that might be a little bit tender, I'm going to stay on that and maybe go side to side to shift the superficial muscles on the deeper muscles. And I can kind of roll my hip to get a little bit more on that lateral quad. So whenever we're trying to increase soft tissue mobility, we want to go for at least 2 minutes. 1.5 minutes is a bare minimum. So we want to take our time, go through these areas, work on our breathing so we're not holding our breath and being like, oh, so apprehensive of the discomfort that's happening. But if you work on exhaling slow, allowing that muscle to release and not to get so tense, that will allow that tissue to get more mobile. And the more often that you do this, the less uncomfortable it will be. All right. And we could switch around to get to the glute if that's, a problem area. We can kind of just sit on it and then kind of go up and down like this. I have my knee bent and I'm supporting myself with my hand. And again, doing for about 1.5 minutes to 2 minutes. All right. If I need to be more intense, I could take this leg, take it into a stretched out position, and then kind of go like this. So those are some of the things that you can go to get into the hip. Now, for the lower leg, the calf muscle, we want to get this motion called dorsiflexion. And dorsiflexion is when your ankle can do this, all right? So basically pulling your toes up. Normal range of motion with the knee straight, I would like to get that angle somewhere between 15 degrees or 10 to 15 degrees at least. A lot of times people will have really tight ankles. They can't even dorsiflex that way. Another check for that ankle dorsiflexion is to go into a kneeling position. I'm going to put whatever structure I can. Actually, you know what? I'm going to get my other foam roller real quick and put this larger foam roller so you could see this. if I put that about 5 inches, 4 to 5 inches in front of my toe, keep my heel down and bring my knee forward, I should be able to bring my knee forward 5 inches in front of my toe without the heel coming up. So that's a good little check to see if you do have ankle mobility. Now, to loosen that up, we can take our foam roll and put it right underneath the calf and then work that area as well. Okay, so again, here you could start with your hips on the ground and just applying that little pressure, repositioning the foam roll as needed to get into that calf muscle. And inevitably, you'll find a little tender point. And if you can tolerate it, we can apply a little bit more pressure, similar to the other parts of our body that we've been doing, by just crossing the leg. Or I can lift this hip up, or do the combo of crossing the leg and lift the hips up, and that creates a lot of pressure through my calf. Work on your breathing, exhaling slow to allow that muscle to turn off, create some shearing. I'm doing the side to side motion, and because our ankle is free when we're doing this, I can kind of pin that muscle down, maybe add a little bit of pressure in my other leg, and start to work the ankle to get that motion back. So I'm creating a lot more effective shearing in the tissue. Think about the deep muscles, deep tissues, and the superficial tissues. All those layers, we need to have them moving and sliding. So I can go different directions here, circles, clockwise, counterclockwise, up and down. The most important is that dorsiflex position. Again, toes up towards me. That's the one that we really want to gain to reduce some of that knee pain. Okay, so that's a soft tissue mobilization. You know, another one that's a little bit more advanced, but gaining in popularity is called instrument-assisted soft tissue mobilization. And this is where we take a metal instrument or plastic or jade or something and work on the tissue. So I've got my piece right here. This is a stainless steel instrument made by Rock Tape. It's called a Rock Blade. A lot of other companies make similar products. It's basically stainless steel or plastic, and it has these different edges that we will use. Now, we think about the knee here. So if I get a little bit closer, kind of show my knee, you might be able to see my ACL repair scar here. But typically, if we do have knee pain that's below the kneecap into the shin where that patellar tendon inserts, we can work on that tendon using our metal instrument. So what I'm going to do is just kind of put that at a 45 to 60 degree angle to the skin. I don't want to go like 90 degrees and do that. I want to go 45 to 60 degrees. And again, push and slide. So this is a more direct shearing that we have done, that similar to what we've done with the foam roller. But I'm doing this on the tendon and on these little bits around the joint to create more sliding into that tendon and the surrounding soft tissue. So as you're doing this, we don't want to cause any increased pain. I'll show you from the side here. So I have that right in front of my knee. You can go over the kneecap. There's nothing wrong with that. But again, it's more effective with not a 90 degree angle, but a 45 to 60 degree angle from there. All right, so we can kind of work through that going up or down, okay? And again, same thing, we can go for a minute to 2 minutes with that, working on that mobility. All right, and there is, a way to kind of even get that into the calf. We can take our soft tissue instrument here and do the same thing, shearing into the calf, up and down. If you could see that on the camera here. So I'm kind of going down in this direction, all different sides of that muscle, that three-dimensional muscle, and I can come up, right, to kind of create that shearing of the soft, superficial tissues over the deep tissues. All right, and then now if we work from the ground up, we can get into a calf stretch. So I've got my half foam roll here, and we're basically going to go into a calf stretch where I'll bring my knee forward. So similar to that half kneeling position, let's angle this towards the camera. I'm going to have my ball of my foot on this foam roll, making sure that my foot is completely straight, 90 degrees from that foam roll, and I'm going to bring my hip forward. I keep my knee straight. I should feel that stretch into the calf. All right, so that's the front view. 30-second hold is the most effective time frame. Anything shorter than 30 seconds, the tissue just kind of snaps back into that shortened position. So here's the side view here. I've got the heel locked into the ground, the ball of the foot as elevated on something. You could use like a block of wood, a textbook, a phone book if you have those, and basically anything to keep the front part of your foot up, the ball of your foot, and I'm gonna bring my hip forward, all right? So here you could see my knee. The other foot can go anywhere, all right? So the more mobility we have in that lower leg, the calf, the less stress we're gonna have on the knee. So there's two muscles in the calf, in the lower leg that we want to address. One, we stretch with the knee straight, and the other one, we stretch with the knee unlocked. So you can kind of go into that position right here, or put my foot out in front for a more stronger, more aggressive stretch. The other thing too is as soon as we bend the knee, this is an example of how that knee needs to bend on axis. I'm going to go forward here, show my knee. I've got my foot totally straight towards this camera. As I go forward with that knee bent and put this foot forward or wherever, that knee has to point in the same direction as my foot. Oftentimes people will get into the stretch and they'll do this. All right, so my knee is going inside of my big toe, or they'll position their foot off axis like that and then bring the knee straight. Okay, so that position right there is a recipe for disaster for the knee. We want the knee to point in the same direction as your foot, especially if you're looking down at your ankle and foot as you're doing this stretch. We want the thigh and the knee in line with the foot, right? So if this is your foot, the thigh should match that as it goes forward. We don't want that thigh pointing in a different direction. Definitely not this, okay? So going into this position, if I can maintain that for at least 30 seconds, that'll stretch out the soleus. If you feel like there's nothing, you don't feel a stretch in there, but you feel knee pain, just go easy with it. You can hold on to something, hold on to a chair or a counter, and just work into that direction. You don't have to push through pain with any of these stretches. You shouldn't go by that old adage of no pain, no gain. You should always listen to your body when we're doing things like a red light, yellow light, or green light, right? So when things feel good, that's a green light, we can go through them. If they feel a little iffy, but not sharp or stabby, just pay attention to that, work gingerly and slowly into that range of motion, and that's a yellow light. Any sharp pain, it's definitely a no-go, then we stop, all right? All right, so another one that we can do is the hip flexor stretch and the quad stretch. So you've probably seen something like this, so you could probably see on the camera. I'm gonna show you on my other knee. So we're going like this, a quad stretch, right? So pretty classic quad stretch, bringing your heel to your butt. If we can't do that, then we can kind of do that in different ways. To stretch out the front part of the thigh, we go into a hip flexor stretch. So we get into this position here, this half kneeling position. I've got my knee below my hip, my ankle and foot are directly behind my knee, and this foot is out in front. So I've got like really a lot of right angles here. Now, what you want to do is stretch out that psoas muscle, the one that I said that starts on our lower back, dives through the pelvis and inserts into the front part of the hip, or front part of the leg. We want to make sure that our pelvis is in a good position. We don't want the pelvis to be tilted like this so that we have a lot of curvature to the lower back. We want to flatten out the lower back by activating the abdominals and the core, or the glute muscle. So we have the glute muscle, that's got to be on. That tucks the pelvis underneath. We don't want it tilted back like that. We want it underneath. And then we want the abdominals on to keep the ribs down so that we don't end up with the ribs up and our back out like this. So I see a lot of people get into this hip flexor stretch and they just kind of go like that. Like, oh yeah, I feel it. But they're stretching way too much stuff and it becomes an unspecific stretch. The back is too arched. So we want to think, all right, I got my glute on, gets my pelvis in the right position. I've got my abdominals on, keeps my ribs down. And then once I have those two parts on, then I'll go into that little sliding the hip forward. And you should feel that stretch a lot earlier. So we get that stretch right into this pocket area and we hold that for 30 seconds, all right? So the more flexible we are through the hip, the front part of the hip, the more efficient that the glute can fire and work, because if this is tight in the front, it inhibits the ability for your glute muscle to function. So the glute muscle is super important when we're squatting or walking. So if I'm squatting, if I'm going to bend my knees and get into this low position and my knees go in, that basically means that my glutes have shut off. My glute muscles, my hip muscles control this move, right? So pushing the knees out, getting the knees to track in the same direction as my feet, that is a function of the glute, particularly the gluteus medius. And if that is inhibited or weak because of a tight hip flexor in the front, you're gonna lose control of the knee joint along the knee axis. So that's another way that we wanna watch out for when we do our exercises. And if you're walking, the other thing too is that as you take a step, we get into this position right here where I start to lift my back heel. That hip needs to extend. It needs to move backwards and be able to have that freedom of motion there so I don't cause more increased stress on your knee. And then I can walk forward. The other thing too is doing a step. Let's see if I put this down here. If I'm going downstairs and your knee hurts going downstairs, that usually is because of that loss of ankle mobility, right? So that test that we did in the beginning where I push my knees forward in that half kneeling position, that's basically the position, dorsiflexion of the ankle when you step down. So if I'm gonna step down, I need to have my ankle to be this mobile, right? So if I don't have this and this starts to get tight, then that creates a lot more stress on my knee as I'm going down versus I'm having a flexible ankle and I could step down and get that ankle motion without creating increased stress on my knee.